One of the most dreaded complications is an anastomotic leak from colorectal surgery. In terms of the patient standpoint, obviously it's devastating. It prolongs our hospitalization, it increases the morbidity. It can be something that's life-threatening in many cases. And of course, many of our complications with anastomotic leak require temporary stomas, and so that also has a huge impact on patients' quality of life. You get a predictable time that it's going to fire, you get a predictable firing of it, the pressure, all those things are the same now. It's sort of, leveled the playing field in terms of who's on the other side holding on to that stapler. I can take my eyes off one thing right now and focus on what really needs to be done in the belly, and I can always count on that reliability on the other side. The GST technology, I think it's one of those innovations that makes us feel like, okay, the engineers are listening to what we're asking for, and we're getting a good anastomosis. Not too tight, not too loose, but just the right amount and equally distributed throughout an anastomosis. I think that's what we've been looking for as surgeons when we go back in and we look at our scope at our circular anastomosis or our linear anastomosis. We're kind of looking for that assurance that we've got a secure anastomosis.